Hello everyone, welcome to CAPSA. Today's topic is proton pump inhibitors. Okay, so what are the cells present in the stomach and what are their secretions? First is gastric cells which secretes mucus. Another one is parietal cells which secretes gastric acid or HCl. Another one is chief cells which secretes pepsinogen which then converted to pepsin. D cells or delta cells or somatostatin, okay, which secretes somatostatin. G cells or gastrin producing cells which secretes gastrin. Now, what are the mechanism of action of proton pump inhibitors? Okay, proton pump inhibitors actually irreversibly bind with the cysteine residue part of the enzyme hydrogen potassium ATPase pump or proton pump, which is present in the parietal cells of the stomach and forms a covalent disulfide linkage, which results in the inactivation and thus blocks the transportation of acid from the parietal cells to the gastric lumen. We will understand this mechanism of action with a picture, okay? So, this is the stomach, okay? All of you know, this part is lumen. This part is known as lumen, okay? Now, in this wall, we will zoom out. In this wall, there is a pump. This pump is known as hydrogen potassium ATPase pump or proton pump. Okay, what it does, it actually sends hydrogen plus ion in exchange of potassium ion to the lumen. Okay, so if this pump is blocked by proton pump inhibitors, then the availability of the hydrogen plus ion in the lumen will be decreased. So the acid production will be decreased. That is the mechanism of action. Okay. Now, what are the names of PPIs? Okay. What are the kind of drugs present in this group? That is omeprazole. Omeprazole is a prototype drug. Okay. Another one is esomeprazole, pantoprazole, lansoprazole, rabeprazole, etc. Okay. You should keep in mind all these drugs should be taken 1 hour before the meal. Okay. Because they interact with food and their absorption decreases. Okay. And the viability obviously decreases. So, now what are the drug interactions? Proton pump inhibitors actually pantoprazole interact with clopidogrel. What kind of drug this is? This is a antiplatelet drug. Okay, this is antiplatelet drug and prevents its metabolism. Okay, and also decrease the bioavailability of some drugs like itraconazole and vitamin B12. And also there are so many drugs. Now, what are the adverse effects? Abdominal pain, hypomagnesemia, skin rashes, headache, nausea and vomiting. Hypomagnesemia means decrease in the magnesium ion concentration in the blood. And when hypomagnesemia occurs, if the concentration level less than 1.46 milligram per deciliter, okay, in the blood. Now, what are the therapeutic uses? In the treatment of various varieties kind of ulcers like PUD or peptic ulcer disease, NSAIDs-induced ulcer or the ulcer which are produced by the use of NSAIDs medicines, okay, and Helicobacter pylori induced ulcers or stress ulcers or curling ulcers, etc. And also in the treatment of GERD and also in the treatment of Zollinger-Ellison syndrome. So what do you mean by GERD? That is gastroesophageal reflux diseases. And Zollinger-Ellison syndrome kind of digestive disorder where gastric acid secretion is too much. And in GERD, what happens? Stomach contents moves up into the esophageal part, okay? Stomach contents moves up in the esophageal part. In the stomach, this part is esophageal part, okay? If the stomach content goes to the upward direction, then this disease is known as GERD, okay? Thank you for your attention.